Hi, I'm Shane Schick, Editor-in-Chief of IT World Canada, and I'm at the gala for the quest for Canada's smartest IT. We're talking here about the smartest IT department. We've been talking about the greenest IT department, but then there are also those projects that just make you say, wow. I'm standing here with the winner of that category, and we're talking about what made it successful. For those people who aren't familiar with eChin, can you talk a little bit about what it is and why it was so important for the Hospital for Sick Children?
Sure. eChin, which stands for Electronic Child Health Network, is Ontario's fully functioning pediatric electronic health records, serving 3 million people under the age 19. The main objective of eChin was, and still is, to improve the delivery of care to children throughout the Ontario's health system and through an electronic health records.
Whenever we've done stories about anything involving managing health information, it's one of the more complicated challenges that we find any IT leader has to face. Can you talk about the kind of team that you had to put together and maybe the other parts of the organization that you had to involve to make eChin successful?
Yes, it's a very good question. Because indeed, the technology is actually secondary here. What is more important is to be able to serve the needs of the clinicians and the patients across the province. And indeed, it requires a collaboration and communication between a variety of different stakeholders across multiple healthcare organizations, a collaboration and a partnership with a number of different suppliers. So in reality, you had to have people who are very good in developing, strategy, able to follow the implementation of that strategy, and be able to clearly communicate and collaborate with all these, stakeholders.
Excellent. James, can you talk about why kind of the WOW category made sense as something to add to the Quest for Canada's Smartest IT, and maybe what your reaction was when you looked at eChin as the submission for that?
Well, to the first point, I think that, as we've remarked before, IT normally gets noticed when something goes wrong. And so, you have IT that can make the organization more efficient and effective, but then sometimes you have IT that can change an ecosystem, that can improve the community in which we live in, that can change the world. And I think as we began to reach out to IT professionals across Canada, we began to find more and more of these transformational stories, and so it just became a category that was begging to be recognized. So that's the answer to the first part of your question. The answer to the second part of your question, I think, is pretty obvious. I mean, here you have an initiative that was conducted, originally and over a long period of time by one institution, but is now serving 3 million folks. And one has to ask oneself, how come the Hospital for Sick Children can accomplish this for pediatric care, and the province has spent a lot more and can't get the job done for the rest of us. So.
Danielle, for eChin, it's obviously been a success to date, and that's why it's being recognized tonight. Do you have any thoughts on maybe any additional features or ways that you see eChin evolving over time?
Another great question, because in reality, since eChin was started 10 years ago, eChin constantly evolved, changed, and was adapted to meet the evolving needs of the clinicians and the patients as well. And those needs will continue to evolve as we will continue to integrate more and more data and information from different sources, as we will bring on board the integration with electronic medical records from physician offices as well. So yes, this is an evolution process, and it's pretty much a journey.
Yeah, that's great. You can find out a lot more about eChin on the Quest for Canada's Smartest IT website. You'll also see coverage of tonight's gala with Danielle at the itworldcanada.com website. For IT World Canada, I'm Shane Schick. Thanks for watching.